Meditate, manifest, invest in you. Join me on my spiritual journey as I elevate myself and like-minded listeners to a higher level mentally, physically, and spiritually. Thank you for listening. This is Black Hippie Lounge, and I am your host, Chanel. Good evening. That was just a little funny clip that I found online about just everything that's going on, the coronavirus, obviously. So someone just, you know how Black people do. We always got to remix something. That beat goes hard, though. I'm not gonna lie. But yeah, good evening. Welcome to Black Hippie Lounge. I'm your host, Chanel. And tonight I want to talk about a little bit about coronavirus, but also just about Black healthcare. I know I said that was one of the topics that I wanted to discuss on the podcast. So I want to talk a little bit about some research that I've done on Black healthcare, specifically Black men in healthcare. There's a reason why I'm doing it. I want to tie it into next week's episode where I plan to have a guest, finally, who is going to be able to bring his expertise or his experience within healthcare as a Black man. Also trying to set up an interview also with some Black women in healthcare as well that I know. So yeah, just gonna keep it rolling. But first I want to say I hope that everyone is being safe due to this situation that's occurring right now all over the world with the coronavirus. And I know, like I said, it's funny like listening to the jokes and stuff like that, but like we still got to be serious too, just because you never know who you're coming in contact with, who may have the virus and they might not even know. So just being aware of your surroundings. Stay inside if you can, if you have that luxury to do so. Definitely try to work from home and just utilize your time. Don't just, it's easy to just kind of get lazy and stuff, or just like, veg out, but still try to use this time to, whether it be work on a hobby, a craft, or try to start something, work on your business or something, something that's going to fulfill you and keep you busy. I definitely suggest that if you can. And so yeah, we're just going to get into it. First, I want to talk about some facts on the coronavirus, just to, if you're not sure what to look out for or what the symptoms are. So according to the CDC, symptoms can take 2 to 4. They can appear 2 to 14 days after exposure. So pretty much like it's saying, 2 days after you've been exposed to it, you might have symptoms. 14 days later, you could have symptoms that show up after exposure. So it's very important to, like I said, be aware of your surroundings. Don't go out if you don't have to, and if you do, just keep your distance from people. Even for myself today, like going to the store, people still want to brush up on you and try to get close to you, and it's just like, bag that, like, you don't know what's going on, you gotta keep your distance. You should be keeping your distance anyway, but especially in times like this, it's just be cautious, take care of yourself, and making sure you're washing your hands, you're not touching things, you're not putting your hands in your mouth or on your face, you're not sharing things with people, just because, like I said, you really don't know. Sometimes for the symptoms to show up, they don't show up right away. But some of the symptoms are fever, a cough, and shortness of breath. So ways that you can protect yourself, because there is no vaccine for this virus right now. Please remember that. So have to be extra careful, extra cautious, avoiding exposure, keeping a 6 foot distance amongst people, especially because this virus can be transmitted through droplet transmission. So if someone sneezes, coughs, that little bit of spit that comes out with that, or the cough itself and the sneeze, those droplets can transfer the virus, whether it be directly to you or on a surface, and it can stay on the surface for quite some time. So if someone sneezed on the desk and you didn't know, you came, sat down on the desk, put your hands there and started, touching it, and then, put your hand on your mouth or something like that, that's an easy way for it to be transmitted to you and transmitted amongst people. So just definitely, please wash your hands. Even though, like I said, I feel like I said this last episode, you shouldn't have to be told to wash your hands, but unfortunately there are a lot of people in this world who do not wash their hands, and definitely trying to stay with that. Just continue washing your hands. You get to sing ABC song or your happy birthday, making sure you're getting in between all your fingers, cleaning your fingernails, and just scrub. Even if you have to be ashy, just make sure you carry your lotion with you. You can have hand sanitizer as well, but hand sanitizer should not be substituting soap and water. Please use soap and water, and avoid close contact. Stay home if you're sick, and also if you're sick and you feel like, all right, this is not normal, or even if you do, just to be sure, you could go to the doctor, just get yourself checked out, and just make sure that you are good and that you're not potentially exposed to the coronavirus. And also, if you can, wear gloves and masks, especially if you're at a job where you're exposed to touching money or touching their hands or anything like that. Definitely make sure you're trying to wear your gloves, and just be cautious. That's the main thing, is just be cautious. You'd rather be overly cautious and safe than just kind of brush it off like it's nothing and then potentially be one of the people who are affected by it, and that would be very unfortunate. Even though most people who have been affected are older, as I cough, just still making sure, and also looking out for your grandparents or older family members that you know of, checking in with them. I know I checked in with my grandparents today, just making sure that they're good, even though my grandmother's running around doing stuff and she's supposed to be in the house, but just making sure that they are getting to A and B. And if you can, I know there's a lot of worry about older people being exposed and going out to the grocery stores and stuff like that, and a lot of them are in situations where they don't have transportation or a way to get to the grocery store. So if you can, try to help them, even if it's just a couple, an hour or so out of your day. If you can just try to help them or take them to the grocery store. I know that a lot of stores are doing exclusive time for older residents in the morning to be able to shop on their own and not to be exposed to everyone else. So if you can, like I said, try to help them as best as we can, to just make sure that they're good, because they are at high risk. And also if you're if you're pregnant, or if you have asthma like myself, or you have some, if you're immunocompromised, you are at a risk as well. So just making sure that you are precautious, if you have your inhaler or your medication that you need, just making sure just be on your stuff, to be honest. Just be on it, because like I said, you'd rather be over prepared than under prepared, and potentially end up harming yourself even more than necessary. So yeah, definitely coronavirus is just, let's just do the best that we can to stay positive, and making sure you're up to date on any updates that occur. I work in public health, so I'm able to get some. If you have any questions, you can definitely email me or send me a message on Instagram. Or also, I have a Twitter page now. It's at Black Hippie Lounge as well. And the same for Instagram, it's at Black Hippie Lounge, BlackHippieLounge. And so, yeah, definitely hit me on there if you have any questions, whether it be about the podcast or about the coronavirus. I'm not an expert, but I can tell you what I know. So, yes. But let's get into the topic of tonight, which is, like I said, I want to talk about healthcare, black and brown people in healthcare, but specifically tonight will be about black and brown men in healthcare. So I feel like there's a significant amount of black men that are doctors now and working in healthcare, but there definitely could be way more. It shouldn't be a shock or, feeling like, oh, I got a black doctor. Like, that shouldn't be not exciting, but a thing that's not normal, I guess, or it's something that is surprising to you. It should just be like, it should be a standard. You should definitely have the option to choose a black doctor if you would like. I know for myself, when I choose my doctors, I always choose someone who's black because I feel like that person's gonna get me the most. They're more than likely have the similar experiences to me, and they should know my things about how black people are in healthcare, as far as certain diseases that might affect us, or certain precautionary things that we should do to prevent certain things from happening, how we should be, our diet, how we how we should be taking care of ourselves. I feel like it's easier that way for me personally. Not saying that it's a requirement for every black person, but for me personally, I prefer to have a black doctor. And I know some people are the same, and could be definitely depending on where you live. I know when I lived in Atlanta, that was a breeze to be able to find. I had all black doctors for everything. But here up in Boston, it's not always that easy to do so, especially to find a black male doctor. So I think, it's definitely something that can be discussed. I know that there's been research on it, and that, they are trying to increase a number of black men and women within healthcare, starting with like acceptances within medical schools. But there's still a long way to go to make sure that there is equality amongst physicians, and making sure, again, not just black, but black and brown, like Spanish, Latino, just making sure that all races are represented within healthcare. Because at the end of the day, there shouldn't be any offense taken to that, because you choose how you want to take care of yourself, and you should also be able to choose who you feel is the best choice in your healthcare as well. If you feel that you would get a better treatment from, say, for myself as a black woman, I prefer to have a black gynecologist. I remember experiencing a very bad experience with a white gynecologist early, like within like puberty time, and I remember for a while, like it I don't know if it scarred me, but it definitely made me feel like, I was very nervous about choosing doctors in gynecology again. And I remember I had a year later, I think that's when I moved. Oh, I didn't move, but I had a black doctor and from a black gynecologist, and from then on I always promised myself that I would make sure that I had a black gynecologist, because that experience with her was so great. She made me feel comfortable. I was able to tell her things without feeling judged or like something was wrong with me. It's always been a breeze from then on choosing black doctors. And also for even like a primary care physician, I just feel that usually they're willing to listen to me when I'm telling them certain things. I've had experiences in my adult years with physicians who I felt kind of brushed off certain things when I was telling them symptoms that I might have had or things like that, and I ended up being correct, and it could have been not necessarily prevented, but it should have just been taken more serious, I feel, and it wasn't. So yeah, just making sure we have you have a doctor who you feel is listening out for you. And again, it doesn't have to be a black person. You can have whatever kind of doctor you want, but just making sure that you have someone who has your best interest in mind. That's the most important. And that's why I'm bringing it up, because now usually when you have a doctor who's of the same ethnic background as you, and they can understand certain things about you, and they're able to recognize certain things that maybe you don't know, are telling tales of certain diseases, or just being able to know based off your family's history certain things to look out for, or how you should be dieting. So that's why I feel like it's important to just make sure you have someone who's looking out for you. So when it comes to, like I said, black men in healthcare, excuse me, it is important to try to support any black man that you know that is pursuing a career in healthcare, and knowing that it's a long journey for them, whether they're trying to be a nurse or a nurse practitioner or a physician or a dentist or any type of within healthcare. It's gonna be a long and tough road for them, but I know having that support system, whether it be family, friends, or just from the community, is important, and it also can just encourage more younger black men to want to be involved within healthcare, because we could use way more black men in healthcare for various reasons. So actually an article that I read from 2018 by Nicole Torres, it's some facts from there I can read off, or that research shows that having a black doctor led black men to receive more effective care. And I feel like this is definitely, that can be true, because similar to what I was saying about my own experience, is that like when you have a doctor who looks like you and you feel is giving you the real deal and like really looking out for you, and not just kind of brushing over and just like giving you the basics, or ignoring certain symptoms that you address, then that can just push you to take care of yourself more. I know that, say for instance, if you have a black doctor and they're telling you, you know what, like I know we like to eat these type of things, but just eating this in moderation, or making sure you mix it up with vegetables and this and that can actually maybe influence a black man, or a black patient to, trust the doctor more and to follow what their orders are, because they feel like, another black person's looking out for them. I know like a lot of black people, we do that. We just feel like we look out for each other. So if you feel like your doctor is looking out for you, then you might be more likely to actually believe what they're telling you for your health, and to follow those rules. So I just kind of want to, before I keep going with that, I wanted to backtrack a little bit to some information that I have, is that Black Americans have some of the worst health outcomes of any racial group. Black men have the shortest life expectancies. Black women have the highest mortality rates. Black babies have the highest infant mortality rates. So what this is basically saying is that we as Black Americans tend to, I would say, I guess, fall through the cracks when it comes to Black healthcare, and it's not entirely on us, but we do play a part in it. As Black patients, we are responsible for making sure that we know what we're supposed to be doing and what our body's supposed to look like, or what we're supposed to be feeling when something is not right, and how to react to that. What I mean is, like, okay, if you know if you pay attention to what your family history is, like, say, okay, I know that my grandfather had diabetes, my dad had diabetes, so there's a likelihood that I can have it too. So I have to make sure when especially as I get older, making sure I'm eating right and making sure I'm staying healthy, I'm working out, exercising, not consuming a lot of sugar, and making sure I am staying on not just my sugar levels, making sure I'm drinking a lot of water, making sure that I'm eating enough vegetables, just all around taking care of myself. That is still your responsibility. Not saying that you should heavily depend on the doctor. You still have to do your own thing too. When it's saying Black women have the highest maternal mortality rates, I can't talk today, then that's important for Black women to make sure that, okay, whether even before you get pregnant, making sure you know what you need to do for your body to prepare for the pregnancy, how to take care of yourself throughout the pregnancy, certain things to look out for that may be a sign of something going wrong, but also even knowing what to expect during your delivery and knowing when to, call people out or call the doctors out and say, hey, this is not right. This is what you need to do. Just because it's not your job, quote unquote, your job is to take care of yourself and to make sure that you survive. So you can't depend on someone else to do that, even if it is their job. I guess that's my point, is that we as Black people need to make sure that we understand healthcare as well, and what our bodies are supposed to be doing, what we're supposed to be feeling when certain things are not right, how to check for certain things, whether it be breast exams. You can do your own breast exams at home. Black men, I believe you can you can check your own scrotum, I believe, to just make sure that, if there's any issues there, checking your breast as well. Black men can get men in general can get breast cancer. It's not just a woman's issue. So just making sure that there's no, uncommon lumps or anything that's going on. But also just, you making sure, like I said, your family's history, so that's another way to kind of alert yourself on certain things, and when things are not making sense or something's not feeling right, knowing when to get yourself checked out. So research also shows that Black patients have the highest rates of stroke and hypertension. And Black men have the lowest life expectancy, 4.5 fewer years than white men. So, to say about that is that having the highest rate of stroke and hypertension makes a lot of sense. I mean, being Black in America, or just Black in general, we go through a lot of things in society that does affect our heart and the stress. Stress can really can lead to a stroke. It can lead to hypertension. It can lead to just your body slowly deteriorating, and knowing how to take care of yourself, how to eat right, exercise, meditate, learning how to deal with certain issues, the best way that can keep you safe is important and essential. So, I guess some ways that I would suggest for and black men and women, but I want to again focus on black men, um, to take care of themselves and to kind of jump the gun on preventing yourselves from potentially becoming sick or or becoming unhealthy. Diet, exercise, making sure you go for your annual exams. It's not just something that you wait till you're like in your 50s to do, because I know a lot of black men, older men, um, or just black men in general, they don't go to the doctor every year like they're supposed to. You should be getting your annuals. It's annoying. I don't like doing it either, but it's it can definitely prevent you from potentially becoming more sick if there's something underlying that you might not have symptoms of. Blood work is important because it can pick up on things. And just the doctor, like I said, the doctors will be able to know certain things that might alert them that you found normal, or you just like, oh, I thought it was just a lump or something. Or I bumped something, but it could be really a serious issue. So definitely, please go get your annual exams. Please, please, please. Know your family history. Ask your parents, your grandparents. I know for myself, I didn't even know that, not diabetes, but something else. I'm sorry, my brain is slipping. Some other type of disease I am prone to having because my grandmother is prone to have it as well. So it's like a family history thing, but I wouldn't have known that if I didn't ask. And for so long, you know how when you fill out those papers, when you go to your doctor's appointment, they're asking, do you have a history of this and this and that or whatever. Usually I would just put no because I'm like, not that I know of, because no one ever told me. But sometimes it's just important to ask as well, because my grandmother might have it, maybe my mom never asked her, and so she didn't know, so maybe she didn't tell me, and then so it's kind of like breaking that barrier and just making sure at the end of the day what you're prone to and what's in your DNA, what's in your history. Smoking and drinking. I would say definitely, like, if you feel like that's something that you want to do, just try to do it in moderation and making sure that you are still taking care of yourself. It's very, very important. And I would say also sexual health is definitely important. Making sure you're getting tested, making sure you're using protecting yourself, and just knowing certain symptoms to look out for yourself. And again, everything doesn't always have a symptom, so just being more cautious is a way to help yourself. You don't want to wait till it's too late. It's better to be cautious, definitely, for sexual health and just health in general. So yeah, I feel that black health care is a topic that is not really discussed. I remember, even when I'm learning right now, I'm learning about healthcare administration, and I feel that we kind of just touch the surface on things. We don't really go into depth about this race versus this race and what to look out for in this person. And I know, like, within healthcare, when you're going for nursing or your medical degree, then you're probably going to learn more about different races and how different races, certain things might show up in this person versus that. But I think it's something that should just be taught in general, even in school, like high school, making sure you know what things to look out for and how to properly care for yourself. I know right now, a big thing is diet and exercise. A lot of people are really getting on that. I feel like the younger generations um, are definitely like I wouldn't say health crazy, but we definitely like we're all about going to the gym and we're about smoothies and we're about eating healthy um, and vitamins and stuff, and that's great because that can create a longer life expectancy. Who wouldn't want to live longer? And making sure you're ensuring that you're gonna give your kids and your future a fair shot. You want to be in your best health when you're ready to reproduce. You want to make sure you're in your best health because not only physically being healthy is important, but that it all ties in with the physical, mental, spiritual health. It all ties together. Taking care of yourself in one aspect is not the only thing that you should be doing. You should be tying it all together. And the more you take care of yourself physically, the better you're going to feel mentally, which is also going to stimulate you spiritually and emotionally. So just making sure, I know there's a lot that goes on in everyone's life day to day, but making sure that you take the time to take care of yourself and to know what to look for if things may potentially be going wrong, and just knowing how important it is for your health. Your health is very important. It's a life or death situation, literally. It could the way you live your life and take care of your body. You only get one body. The way you take care of yourself is going to determine how you are in the future or as you get older. So just instilling those practices in yourself now to take care of yourself and make sure you're eating right and exercising and going to your visits, drinking and smoking if you want to in moderation, or just making more healthier choices is very important, very, very important. So I would definitely gonna expand. I just want to give a brief info on this topic because again, I do plan on having an interview where I'm gonna get some more insight from someone else who is gonna be able to share his experience within healthcare as a nursing student, and he's currently working in healthcare. He's actually one of the people like probably right now like who's just dealing with this whole coronavirus and how he's an essential employee and what that means and within his job, and just want to get like his day-to-day experience, but also just his experience in school, and what he plans to do with his future degree, and what his plans are career-wise in healthcare, and how he feels not only just career-wise but personally with having a doctor, going to the doctor, and as he's gotten older, what has his experience been and what he feels that healthcare needs from the black man's perspective, and as a black man working in healthcare but also just experiencing healthcare, what exactly that really means. Definitely plan to have that interview next week. Looking forward to that. I want to thank you for tuning in. Please remember, take care of yourselves. Coronavirus is serious out here. Making sure if you have any symptoms to just get it checked out. It's better to just check and be sure. I'm going to close that out. I hope you guys have a great night, a good week. Take care of yourselves, and don't forget you can email me at blackhippielounge@gmail.com. Follow me on Instagram. It's at blackhippielounge. Follow me on Twitter at blackhippielounge. So I just thank you for tuning in and listening. And please, if you have any questions or any suggestions for topics, or you want to be a guest, you may have something that you want to talk about, please message me. Let me know. I would love to connect with people. And don't forget, meditate, manifest, invest in you. Have a great night.